Yeah, we're under a mortar attack again.
The memories haunt this soldier from his service in Iraq.
That's smoke from our lovely trash pile here on Anaconda.
Not from the battlefield, but from a burn pit.
The fire just keeps... You don't really see the fire, but you see the smoke.
Open-air burn pits were used to get rid of garbage and waste on military bases throughout the Middle East. This vet asked us to conceal his identity because of his work as an intelligence officer. He tells us during his time at Balad Air Force Base in Iraq, he was breathing in burn pit smoke day and night.
You could just taste it. It was like this sickening thing that kind of burnt the back of your throat.
He says he's now suffering from an incurable lung disease, chest pains, and at the age of 39 has a pacemaker. He blames it all on the burn pit. It's unclear just how many veterans have been exposed. Around 3 million soldiers have served in Iraq and Afghanistan. However, over the past decade, the VA has received more than 11,500 claims related to burn pits. Only about 2,300 of those were actually approved. That's where veteran and Penn graduate student Chad Baer comes in. He wants to use military data to help identify soldiers exposed to burn pits.
It's kind of like predictive analytics for taking care of people and what they're exposed to.
Baer's plan calls for a revamping of the VA's current burn pit registry. That's the site where veterans can sign up and say they were exposed to the pits.
It's a pretty flawed tool.
He says the registry doesn't ask all the right questions. He wants more information collected from veterans, such as how close they were to the pits, what was being burned, and the names of other soldiers they worked and lived with. That way, connections can be made and conditions can be tracked by groups.
When 2 people out of 30 have this rare cancer, it sets off an alert. And the VA can go from being a laggard who's constantly getting beat up by the media to kind of a leader.
Besides working to get the VA on board, Baer needs information from the Department of Defense.
They know who was where when, and that's the foundation.
But getting the DoD to release anything regarding burn pits is not going to be easy. The department has not offered up comprehensive information about what was burned and when. It has declined our repeated requests for interviews, but we're not the only ones. The DoD has not shown up for congressional hearings and roundtables on burn pits.
It tells me that they're trying to skirt away from accountability and responsibility.
Congressman Raul Ruiz of California has authored a number of bills to try to get better medical care for those exposed to burn pits. He's also a medical doctor.
If we don't know what was burned, then we won't be able to identify the health risks in order to outreach to our veterans.
The VA has the mandate to care for veterans, their health. I think that our legislature or executive office compels the DoD to give them the data.
Baer took his plan to D.C. last week, meeting with legislative staffers. He hopes it will jumpstart interest in his project.
If we don't compel resolution on this sooner and we don't get the foundation set with the proper data, we will be fighting this for a long time. A lot of people will suffer.
Both the VA and DoD told us in writing that they work together on a variety of burn pit exposure issues. For more information on burn pits and to see our other reports on the issue, head over to NBC10.com or the free NBC10 app. I'm Jim Rosenfield, NBC10 News.